Six Sigma methodology. So Six Sigma methodology. Methodologies means what? It means certain procedures, okay, series of steps that take you towards your accomplishment of a study or a research. Okay, the way method of doing a study. What kind of method are you using? There are different methods to do a research or a study. So, what kind of method are you using to get the answers, to find solutions? Okay. So, first is DMA-DB methodology. So, this is also a framework in Six Sigma. It focuses on development of new product, service, or process. Something new if you're creating. Okay. It's not for something that is existing and you want to bring a change. No. Something new. Okay. A new product launch, a new service launch. Okay. In such cases, the DMA-DB methodology is used. It is an acronym for the 5 phases of DMA-DB: define, measure, analyze, design, and verify. So this approach is useful when you are implementing new strategies because of its early identification of success, basis in data, and thorough analysis. Okay, if new strategies are being used that has never been used so far, something new, some new change is coming, and you want to test the waters before implementing it full-fledged. Okay, so DMA-DB methodology will be used. It also ensures the optimum balance between three perspectives. Okay, your customers need, your processes or procedures to fulfill the customer's need, and the company's goal and objective. Okay, these three perspectives has to be balanced. Okay, this DMA DB should not be used in areas where your customers are not at all interested in. Okay, when there is a customer need, when there is a process or procedure which addresses those needs and the goal of the company. Okay, these areas should be balanced while you are doing the DMA-DB methodology. It is a general strategic level approach that tries to help in solving problems related to development of a new product, service, or process. Anything new, if you are producing, you will face some problems in that. So solving those problems. Okay. In various industries, even in manufacturing industry, service industry, transportation industry, okay, wherever significant success will be there, DMA methodology is used. So define, D stands for define the problem or project goal that needs to be addressed. Okay, to start the DMA-DB methodology, you should understand what is the problem or what is your company's goal that has to be reached. Okay, once you have the understanding of that, then you move to the next step, that is measure, and you measure the customer's needs and specifications here. Without having customers needs, without knowing customers needs, you cannot do the DMA-DB methodology. Then the third step is analyzing the process to meet customers' needs. Okay, how will you you get to know about your customers' requirements, what your customers expect of your institution. Okay, once you have that data, how will you meet those needs? Okay, if your customer wants your hospital to have more specialities, okay, or some specific specialities, how will you implement that? Okay, what can you do to make sure those specialties are there for your customers? Then you design a process that will meet the customer's needs. Now, in after the analyze phase, you get the idea how to bring in new specialties. You design a new area in your hospital where a new specialist can come and do their work. Okay, so that you will design an area for it. You will design a process of admitting patients through that new specialty. Okay, and once you have designed this area, you verify the design performance. Okay, few customers will come see the specialist, they will give their inputs. Okay, and you will see if the new specialist and the new specialty area, okay, is able to meet the customer's requirements or not. So that is DMADB methodology. Define the project. In M phase, you determine the customer's requirements, their needs, understand the needs. In A, you identify the functions and generate different functions, select concepts which can fulfill those needs. Okay, in design, you will develop a design, test the design, see if it is working out or not. And in verify, a final verdict will be given. If the new design works, okay, is it meeting the customer's requirements or some new other solution has to be implemented. Next is DFSS methodology. DFSS stands for Design for Six Sigma. Okay. So usually DFSS is used in areas or in institution where Six Sigma has not been used yet. Okay. The institution does not know anything about Six Sigma yet. So you are preparing the institution to work with Six Sigma. So that's when you use DFSS. For the first time when you are developing a new product, okay, in such a way that tomorrow when the institution applies Six Sigma, changes to this product or service will be easy. Okay, so you develop a new product using DFSS methodology in such a way that tomorrow if any change comes into place, any process change is made using Six Sigma methodologies, it will be a very smooth transition. Okay, so that is DFSS, designed for Six Sigma. So it is a different approach to new product or process development in which there are multiple methodologies that can be utilized. Okay, and it is most effective when used to improve current process or make incremental changes to product design. Incremental changes means today, this year, one change has been made. Next year, again, another change will come. Like iPhones, okay? Every year, a new version of iPhone is been released. It's an incremental change that we see in the iPhone series. Okay, so they are also using DFSS methodology. Okay, today the change that you see in iPhone, there is a room for further change next year. It's because of DFSS. They are making iPhones with DFSS methodology that tomorrow, if they have to upgrade their version, it's easy. Okay. So with DFSS, the team must be cross-functional to ensure that all aspects of the products are considered, from market research through the design phase, process implementation, product launch, everything is considered. The goal is to design products and process while minimizing the defects and variations in their routes as much as possible. And the expectation while you are in the DFSS situation, your expectation is you have to develop a product which is reportedly 4.5 Six Sigma or greater. Okay. So that is DFSS. Once you implement DFSS, it is the first step. Then you can smoothly implement other Six Sigma methodologies, DMAC methodologies. Okay. New product development, DFSS. But existing product improvement, it is DMAC methodology. Okay. So in new product development, you observe, okay, what are the needs of your customers, where you have to work more on. You design and develop based on your observations and the data collection. You will design and develop a product, and then finally you will test and launch the product once it is developed. Testing has to be done. A small survey has to be done to understand if the product can work well or not. That is DFSS. So coming to DMAC methodology. So this is the most classic kind of methodology, DMAC. Okay. In majority of the Six Sigma fields, DMAC is the one that is used. That is the most common methodology that has been used. So it is a data-driven quality strategy used to improve processes, and this is also a very integral part of Six Sigma initiative. But in general, it can be implemented as a standalone quality improvement procedure as well. Without the Six Sigma name being attached, DMAC as it is can be used as a quality improvement procedure. Even in lean management, DMAC can be used. So it's an acronym which stands for define, measure, analyze, improve, and control. Each one of these steps we will discuss in detail. So in the define phase, you have to define the problem, okay, or improvement activity, or any opportunity that you see where some work can be done. Project goals, organizational goals, customer requirements, these can also be the defining statement, okay. Voice of the customers to understand the feedback from current and future customers. Value stream mapping is done, okay, which is process flow is done. What the customers actually want from the project, that has to be understood. What you understand are issues within your organization that has to be addressed. That can become a goal, a project goal. Scope of the project, that is opportunities. Critical to quality aspects. Okay, every institution has its critical to quality. Okay, means any drawback in critical to quality areas, your quality will go down. Okay, for example, if there is an outbreak in the hospital, outbreak management is critical to quality in hospitals. Okay, but if there is an outbreak within the hospital, the entire hospital's quality will go down. Okay, and what is the reason for change? You also have to mention why you want to change certain things. So usually CPOC, you can do a CPOC chart in defined phase. CPOC means it stands for suppliers, inputs, process, outputs, customers. Suppliers who are the stakeholders within the hospitals, okay? Your staff, physicians, doctors, nurses, surgeons, pharmacists, wholesalers, okay? They all are the suppliers. Inputs is your patient information that you have collected, medications that you sell, okay, prescriptions that your doctor has made, okay, and processes, all the hospital processes, different types of hospital processes, admission, discharge, injection, radiology process, x-ray process, okay, laboratory processes, all the processes will come, because here you are using the inputs to give an output to the customers. Okay, so what is an output? When customers receive the prescription, when customers go and get the medication, okay, when customers or patients get educated by your staff, health education, okay, these all are the outputs. And finally, the customers, who are your customers? Your patients, patients' family, healthcare professionals, your own staff is also your customer. Okay, so we use a CPOC chart in the defined phase, process map, value value stream map, okay, customer feedback, these all can be used in defined phase. Then measure phase, you have to measure the process performance. Okay, process map for recording activities, it is performed as part of the process. Capability analysis to assess the ability of process to meet specification. Pareto chart can be used here. Okay, these are the different charts used. So in the measure phase, right now, what is happening, you have to list it down. So different process mapping can be used, identify the inputs and outputs. You can measure the gap. Where are you right now? Where you want to reach, where is the current scenario, and where you want to reach, that measurement can be calculated. You can measure the overall performance of the core business process as well. Cause and effect matrix can be made. Okay. So in measure phase, you collect data points, data points from the current situation. So you do the cause and effect diagram. In cause and effect diagram, this is an example, okay? Or how to use cause and effect diagram, we'll teach later in the tools of management, okay? This is an example, fishbone diagram, cause and effect diagram, or Ishikawa diagram. These are the other names for this methodology. In analyze phase, you want to determine the root causes, why something went wrong. Why does the customer need this? Okay. How things went wrong. You find answers to these questions. So you perform root cause analysis. You identify what is wrong, how it went wrong. Okay. You identify critical inputs in your hospital. Okay. Develop processes that has to be implemented. Okay. Develop solutions that has to be implemented. Plan A, plan B, plan C is developed. Okay. And you sometimes you can also revise your CPOC and process map that has to be implemented. It is documented right now, It is not in practice yet, but at least you have a roadmap. Okay, you have a list of things to do. Okay, there is a guideline you have set for yourself that can be followed, implemented later. So that is the analyze phase. You find solutions, you write down the solutions, how to do things. And DMAT methodology, brainstorming. In DMAT methodology, the analyze phase, brainstorming can be done. Pareto charts can be used. Fishbone root, to find the root cause, fishbone is used. 5 why technique can be used. Scatter diagram can be used here. Flow charts, run chart, histogram, control charts, simulation, design of experiments means simulations. Tree diagram, critical to quality tree can be used. Okay, these things can be used to find out answers, to find out solutions in the analyze phase. Next is the improvement phase. In the improvement phase, whatever solutions you have in the analyze phase, that has to put into action. Okay, so improvement phase is an action oriented phase. Okay, so here you will, if you do a Kaizen project, okay, if you are working on a Kaizen project, okay, it's not in writing or in papers, but you have actually started working on it. Okay, so that's the improvement phase. You find any breakthroughs while problem solving. Okay, you apply all the tools and techniques. Okay, you are taking actions. You identify the best option that gives you the highest gain. Okay, you prioritize and evaluate the solutions. Okay, because solutions also come in a rank 1 solution, rank 2 solution. Okay, solutions that have got the most number of votes. So based on that, you have to prioritize each and every solution and start implementing it. If solution 1 does not work, you have solution 2. Okay, like that. And you conduct a lot of feasibility studies. Okay, if we apply solution A, what will be the budget? If you apply solution B, what will be the budget? Is it feasible to do it? Okay, financially, economically, environmentally, certain solutions, if they are feasible or not. Then develop preliminary solution timelines, cost benefit analysis, train people. Okay, these things has to be done. If anything new has been implemented, your staff should know how to use it. Okay, so that's why training of the staff comes in improvement state phase. So these are the tools that you can use in the improvement phase. Root cause analysis, okay, identifying the solution and practical methods with root cause matrix, feasibility matrix, cost benefit analysis, barriers analysis, drivers and barriers. Doing pilot study. Pilot study means test study. Before applying a solution for the entire hospital, apply it at for one department. See how the department responds. And then if it is positive, apply to the entire hospital. Okay, that is pilot studies. And finally, you have the control phase. So it is for future improvement. Okay, control phase is for future improvement of the same processes. So you have quality control under this, standardization, control methods, alternatives, responding to when defects affect. So quality control comes under control phase. Something goes wrong, you find out why it went wrong and you eliminate those causes. Standardization, things that work, routines that work becomes a standard. Everyone has to follow that standard. Then alternatives. If plan A does not work, go back to plan B. That is also a control phase. Okay. And whenever something goes wrong, defects happen, errors, medication errors, like that, if it happens, you have to respond and document it. So Pareto chart, graphs, standard operating procedures, guidelines, control charts. Okay, these are the tools used in the control phase. So that's about Six Sigma methodology. If you have any queries, you can mention in the chat box.